1,221 days ago, WHO learned of a cluster of cases of pneumonia of unknown cause in Wuhan, China. On the 30th January 2020, on the advice of an emergency committee convened under the international health regulations, I declared a public health emergency of international concern over the global outbreak of COVID-19, the highest level of alarm under international law. At that time, outside China, there were fewer than 100 reported cases and no reported deaths. In 3 years since then, COVID-19 has turned our world upside down. Almost 7 million deaths have been reported to WHO, but we know the toll is several times higher, at least 20 million. Health systems have been severely disrupted, with millions of people missing out on essential health services, including life-saving vaccinations for children. For more than a year, the pandemic has been on a downward trend, with population immunity increasing from vaccination and infection, mortality decreasing, and the pressure on health systems easing. This trend has allowed most countries to return to life as we knew it before COVID-19. Yesterday, the emergency committee met for the 15th time and recommended to me that I declare an end to the public health emergency of international concern. I have accepted that advice. It's therefore with great hope that I declare COVID-19 over as a global health emergency. However, that does not mean COVID-19 is over as a global health threat. Last week, COVID-19 claimed life every 3 minutes. And that's just the deaths we know about. As we speak, thousands of people around the world are fighting for their lives in intensive care units. And millions more continue to live with the debilitating effects of post-COVID-19 condition. This virus is here to stay. It's still killing, and it's still changing. The risk remains of new variants emerging that cause new surges in cases and deaths. The worst thing any country could do now is to use this news as a reason to let down its guard, to dismantle the systems it has built, or to send the message to its people that COVID-19 is nothing to worry about. What this news means is that it's time for countries to transition from emergency mode to managing COVID-19 alongside other infectious diseases. I emphasize that this is not a snap decision. It's a decision that has been considered carefully for some time, planned for, and made on the basis of a careful analysis of the data. If need be, I will not hesitate to convene another emergency committee should COVID-19 once again put our world in peril. We must promise ourselves and our children and grandchildren that we will never make those mistakes again. That's what the pandemic accord and the amendments to the international health regulations that countries are now negotiating are about. A commitment to future generations that we will not go back to the old cycle of panic and neglect that left our world vulnerable, but move forward with a shared commitment to meet shared threats with a shared response.
Why now? Firstly, because the main criteria for such a transition are now met. It is true that the virus continues to circulate in every country and that the pandemic is not over. It is true that there are many uncertainties, particularly regarding the evolution of the virus. It is true also that there are big gaps in surveillance, reporting, and healthcare, particularly in the most vulnerable countries. However, the situation has markedly improved, with less mortality and an increased immunity against the virus, immunity which is vaccine-induced or naturally induced, and a better access to diagnostics, vaccines, and treatment.
The battle is not over. We still have weaknesses, and those weaknesses that we still have in our system will be exposed by this virus or another virus, and it needs to be fixed. Our ability to prepare, the equity in our systems, our ability to innovate, the strength of our health systems, and not just the strength of our public health emergency response systems, but the inherent strength of our health systems. Dr. Tedros mentioned our EPI and immunisation programmes have been weakened. Access to cancer therapy has been weakened. Many other parts of our health system have been threatened and have been made vulnerable, even more vulnerable by COVID. COVID has ended as an emergency from a global perspective. But COVID is still an emergency for a family who have a loved one who contracts COVID today and needs to go to hospital. That is still an emergency. That's an emergency for a family. It's an emergency for a community.
Epidemiologically, this virus will continue to cause waves. What we are hopeful of is that we have the tools in place to ensure that the future waves do not result in more severe disease, don't result in waves of death. And we can do that with the tools we have at hand. We just need to make sure that we are tracking the virus because it will continue to evolve. The crisis phase, the emergency phase is over, but COVID is not.